Good afternoon, and thank you all for being here today on Monday, and thank you for what you are doing to fight COVID-19 in Mississippi. We have always tried to be straight up and to be transparent about what's going on with coronavirus in Mississippi. No false panic, no false positivity. I'm encouraged today that in the middle of a nationwide surge of cases, Mississippi has been slower than most other states in our increases. In fact, last week we saw a 17% decrease in 7-day numbers. That's good. This weekend, we saw numbers go up slightly more than the previous weekend. That's bad. None of this fits neatly into political narratives. It's my job to give you the facts and to help you assess the risk. One additional bit of good news. We've talked before about the effective reproduction rate, or R0. That's a key measure of how fast the virus is growing. I've warned of severe danger when that number was particularly high. Today, Mississippi has the lowest in the nation, and we are the only state that is currently under the key number of 1.0. That's remarkable. That's a positive. That's good. But of course, nothing is inevitable. That can change, and it has changed many times throughout this pandemic. But it is a great collective achievement by the people of this great state. Our contact tracing has identified a few more counties that qualify for the additional measures we announced last week. And because of that, today I have signed an executive order that will add 7 counties to the 9 that we mentioned last week. Those 7 counties are as follows: Harrison County, Madison County, Marshall County, Jones County, Carroll County, Leake County, and Benton County have been added to the list. We know that this is not over. We know that we are still in the middle of this fight. People are tired of it. The good Lord knows I'm tired of it. We need to find a way to deal with this that never returns to the economic lockdowns of the past. We need a sustainable plan. We believe that localized efforts to bring intense focus to those hardest hit areas will have the greatest impact. Incidentally, that's also in line with the World Health Organization and what they have recently advocated for. David Nabarro, their special envoy for COVID-19, recently said something that is really wise that I wanted to share with the people of Mississippi. And I quote, "Trying to deal with small spikes of a disease is best done locally. It's not best done from some central control center. And it does mean really leveling with people, saying the only way we can do this is for all of us pulling together. Physical distancing, face protection, isolating if we're feeling ill, not going to the pub or work if we're feeling rotten, and protecting those who are most at risk." End quote. That's the goal. That's what we're trying to achieve. We can open schools. We can open businesses. We can wear masks. We can respect the severity of this virus. And I'm hopeful that we can all pull together and get through this together, because that's the only way we can get through it. Again, I want to thank all of you for being here today. We have Dr. Dobbs with us, who is going to give us an update on the numbers. Dr. Dobbs?
Thank you very much, Governor. Today, we're reporting 675 new cases from over the weekend, 228 from Saturday, and 447 from Sunday. We're reporting, sadly, 8 additional deaths. Other things that we're monitoring closely, one of which is hospital capacity. Currently, we have 580 COVID patients confirmed in the hospital, with 157 in intensive care and 66 on ventilators. This is relatively stable compared to over the past several days. 19% of ICU capacity remains available. One of the things that we've noted and are monitoring closely is the majority of the cases are non-COVID, but there is a significantly large number of folks currently hospitalized that may come into play as additional COVID cases require hospitalization. If we look at ICU capacity, there are 6 hospitals in the state that do not have ICU beds. These are, large referral hospitals. And in Jackson, it's still pretty tight. 3 ICU beds are currently logged as available in the Jackson metro area among the major medical centers. A couple of things just to mention as we go into Halloween. I just would like to remind everyone, please, to be safe. Keep it simple, short, and outdoors. CDC has some great recommendations, as does the American Academy of Pediatrics. The same rules apply if you're wearing a mask and you're outdoors and you're separated from people. You're going to be a lot safer. And if you're touching candy, or treats, please use hand sanitizer, wash your hands with extreme frequency. If you're going to trick or treat, please do it safely. And please look at the CDC and the AAP guidelines. And as we go into the holidays, let's think about how we can do it most safely, especially for Thanksgiving and when we might be seeing family members. A couple of quick sort of ideas just to kind of keep you safer. Keep it nuclear. If we can do sort of smaller family gatherings, people in your household, that's going to be a lot safer. Large family gatherings and mixing younger and older folks is really a recipe for transmission and then severe illness. So please keep that in mind. If you're going to do something social, keep it small and outdoors. I know it's getting colder, but at least we don't live in Wisconsin. We do have a lot more options than other states in the country. And then please wear a mask in public. We know it's a very important mechanism to protect us from transmission and to spread it and keep it from spreading it to others. And Governor, that's all I have. Thank you very much.
Thank you, Dr. Dobbs. Appreciate your efforts as always. We do have what was a tropical storm several hours ago forming in the southernmost part of the Gulf of Mexico. I understand it may have actually strengthened to hurricane strength within the last couple of hours. I'm going to turn it over to Director Michelle, who I'm sure is going to touch on that as we prepare for what could be a difficult weather system in the middle to latter part of this week. Sir?
Thank you, Governor. Good afternoon, everyone. Yes, we'll start off with what is now Hurricane Zeta. That is just strengthened within the last hour to a hurricane. Currently, this storm is in the vicinity of the Yucatan Peninsula, and it'll be entering the Gulf of Mexico sometime tomorrow, and as expected, as a hurricane. This system is moving fairly quickly across the Gulf. We do anticipate the possibility of this storm strengthening as it gets into the Gulf of Mexico. We also anticipate that the storm will reduce in strength rather quickly as it approaches the Gulf of Mexico based on some wind shears, some cold fronts and wind shears that are just off the coast. So we hope that will happen and will break this storm up. It is currently projected to come ashore as a upper end tropical storm. Could be as much as a Category 1, low end Category 1 hurricane. Anything is possible, as you know, for storms like this, certainly ones that come about this late in the year. Now, one thing that I want to emphasize to everyone is to not get complacent with this hurricane, even though that the messaging on it would indicate that it may not be a very strong storm. I want to point you back to Hurricane Delta. Hurricane Delta did not have the major impacts on the state of Mississippi as we originally thought, but we did have over 100,000 residents without power come Saturday morning after that storm hit. Some of those residents were without power for 7 to 10 days in Wilkeston, Amite County, Lincoln County, and counties in the southwestern portions of the state. So you need to make preparations regardless of what this storm is anticipated to do, because lengthy power outages result in spoiled food. It results in a lot of inconveniences in your home, so please make preparations now. Impacts that we can expect from this storm are upwards of 3 to 6 inches of rain in southwestern portions of Mississippi. Wind gusts along the Mississippi Gulf Coast as high as 75 plus miles an hour. Spin-up tornadoes are always a possibility with weather like this. And then storm surge potential, certainly we'll have some surge. We don't know what that's going to be, but we'll be able to get better information once this storm gets out in the Gulf of Mexico tomorrow. We mentioned hurricane, so skip just real quickly back to Hurricane Delta. We're still about $1 million short of damages that we would need to make and meet the state's threshold for that. We're still gathering damages. It's unlikely that we will be requesting a federal declaration for that storm at this time, but we still have some time left on the clock for that. With regard to shelters, we did do testing with shelters during Hurricane Delta, and I want to make a comment about that. Some people did not come to the shelters because testing was being done. I just want to point out that testing is not going to be mandatory when you come to a shelter. It is there as a monitoring source. We don't want to turn anybody away from a shelter. We had some elderly that decided not to come to a shelter. I know particularly in Natchez because they thought it was going to be the brain sample that was going to be tasted. These are the quick tests that will be conducted at the shelter. So please, if you need shelter, come to the shelter. This is the very easy nasal swab. It is not up in the brain. It's very easy, very quick, and it's 15-minute results on that. And then finally, just to give you an update on the Mississippi Emergency Relief Fund that closed out on October the 15th, we have now sent out payments totaling $40.8 million to counties and municipalities. We have a total of about $56 million in projects have been approved and are pending payments to go out to them. So we're continuing to wrap that program up and should be on time to have that remainder of those funds turned back over by the end of November. So, Governor, that concludes my update, sir.
Thank you, Director Michelle, and thanks to you and your team. As always, we will continue to prepare for what is now Hurricane Zeta. We will know more within 24 hours once it gets beyond the Yucatan Peninsula. As you all know, anytime these storms have the opportunity to go over land, lots of different things can occur. And so if it continues as is currently anticipated and it just nicks the edge of that peninsula and it gets into the Gulf, we'll be able to, at that point, have a significantly better idea of what's going to occur. But if you look at the track today, it is very tight, and we are going to bear the brunt of this storm. And so hopefully it will decelerate and be significantly less strong than what it currently looks like, but we'll know more information in the coming hours. So with that, we'll turn it over to questions. Yes, sir.
Yes, Governor, last week you mentioned that y'all are watching some counties. Now, one of these counties was Harrison, and that was added this week for the order. He also mentioned Hines and Rankin last week. How are those counties doing? And also, are there any other counties that y'all are closely monitoring right now for maybe another future order?
Yeah, so as you will recall, these criteria that we put in place are entirely objective. A county has to have more than 200 cases over a 2-week period with an incidence rate that exceeds what the White House considers to be in the red zone, which is more than 100 per week, or in this case, since we're looking at 2-week numbers, more than 200 over the 2-week period per 100,000 residents, or any county that has more than 500 cases per 100,000 residents meets that criteria. When you look at Hines, and by the way, these data points that we look at are not specifically new cases as they are reported on a day-to-day basis. They are based upon the date of onset of illness, and so that's why the Department of Health and their data gatherers and data collectors are so very important in this process. If you look at both Hines and Rankin, they did not meet that criteria this week, but both of them are relatively close. And to put that in perspective, last week of those three large central Mississippi counties, Hines, Rankin, and Madison, last week Madison was the least likely to actually meet the threshold this week. Madison met the threshold, Hines and Rankin did not. And so we added Madison County this week, and we will continue to monitor over the next week. But Hines and Rankin are very large counties, and we know that. We're very pleased that they have not met the threshold this week, but both of them have numbers that are in such a position where they could very easily meet the criteria in the coming days. Yes, sir.
Governor, I was gonna ask about a follow-up to his question, because that was what I was looking at too. If you only go by new cases, and of course you had mentioned you went by date of onset of illness, and again, depends on the cutoff of that 2 weeks, and you and I've talked about that. But, I mean, looking just purely at new cases, Madison has the least of the three counties. Hines had 490 over the last 2 weeks, and Rankin had 352. Madison had a little over, they had 311. So, I mean, at what point do you, cross over and say, okay, well, those new cases do hold some weight in this formula?
Right. Well, the total number of cases matter, obviously, and that's why we have the 200 threshold. But obviously, Madison's population size is a little bit smaller than both Hines and Rankin. That is the primary reason that they fit the criteria this week. Just for transparency's sake, we use the data that we are using is the 2 week period from October 5th through October 18th. That coincides properly with the numbers that we used last week, which concluded on October 11th. And so, again, the 1 week delay there is to give our contact tracers at the Department of Health the opportunity to go back and actually look at date of onset of illness. Because what we saw back in July, that we are potentially seeing some now, is as cases rise around the country and even as cases rise here, the total number of daily cases reported, while that's important and we need to monitor it, it is not the only data point that matters, because you find yourselves with private labs and other areas where we can't necessarily pinpoint exactly when they are. We know when they're reporting, but we've got to figure out exactly when those cases occur. So, for instance, we know how long it takes that if you use the Department of Health lab, we know how quickly they can get the results back. But with private labs, there's variability there, and that's the reason the date of onset of illness. So again, when you look at these counties that don't quite meet the threshold, like Hines, like Rankin, what I would say to you is we have a very objective set of criteria. You either meet the threshold or you don't. I'm not picking and choosing counties. I'm just here. I picked and chose the criteria. Those two counties don't make it. Madison does. But, and here's an important point. If you live anywhere in Mississippi and you want to be in the game to help us reduce the risk of spread and overwhelming the healthcare system, if you go out in public, wear a mask. Stay socially distanced. Don't get close to one another. Don't have big events where, for social purposes, we've got a long list of events and the way in which you can go about doing them safely. Dr. Dobbs talked earlier about both Halloween and Thanksgiving, about the ways to mitigate risk. And that's really what we're talking about here is, what can we as individuals do to mitigate risk? If you have a restaurant, for instance, and you are having people come into that restaurant, there's a way to set up your restaurant such that it is significantly less likely that people are going to be in close proximity. And if you're not in close proximity, and particularly if you're outdoors, the likelihood that there's going to be tremendous transmission is significantly less than if you don't meet that criteria. Yes, sir.
Thank you, Dr. Dobbs. This question is for you, going back to Halloween. I guess in a way it's a two-part question. You opened up with guidelines, so you are, as our state health officer, saying that it is possible to have a safe and enjoyable Halloween. And what would some of these guidelines be from the CDC? How can people have a safe Halloween and avoid spreading or touching all the same surfaces with the candy jars and whatnot?
Yeah, so I do encourage you to go to the CDC website and look. You don't have to do Halloween, right? So if you're worried, or if you're worried about being exposed or older, or you don't want to get your kids out, please stay home, stay safe, do something with your family. There's lots of fun ways to enjoy. I always get tickled by the Simpsons Halloween special, right? So there's different things that everybody can do. So please be safe. But we understand it's been a long, hard pandemic, and if kids need a little bit of a break, there's safer ways to do it. There's not 100% safe anything, really, if you're out in public these days, but it's the same simple stuff. It's going to be maintaining distance from one another, wearing a mask when you're out trick-or-treating. There's sort of recommendations about having like to-go bags that people can pick up so you're not like, interacting with somebody, frequent hand washing, that sort of thing. So please visit cdc.gov or the American Academy of Pediatrics, and there's some really good guidelines on ways you can do Halloween safer.
I feel like this is going to probably pop up by some people, so I'll give you a chance to explain it. Does a typical Halloween mask at all work to stop the spread of COVID, or should you stick with this?
You need to have a cloth mask, a normal kind of mask we'd use to prevent coronavirus. Yeah, a Hulk mask with holes in it are not going to help you at all. Yeah.
Good to know.
Dave Elliott with WLOX.
Thank you. Governor, now with the addition of these 9 counties, that takes us up to 16 counties in effect till November 11th. Election day, next Tuesday, November 3rd, have you considered at all, would it work into your ideas constitutionally to maybe require masks specifically at polling places in all 82 counties so people would feel comfortable about voting in person?
Well, thank you for the question, Dave. I don't anticipate that I am going to mandate mask at every polling location. I do anticipate that the vast majority of Mississippians, when they go vote, are going to wear a mask. If you see some of the, and then this is anecdotal, it's not quantitative, but I think it's important to note, if you look at some of the lines at various locations that we've seen over the last several weeks with absentee balloting taking place, the vast majority of people who are standing in line are doing so with social distancing in place. They are wearing masks even though it's not required. And so I think what you're going to find is that we're going to have a safe, secure election in our state. I think the vast majority of Mississippians are going to wear masks. I think the vast majority of those poll workers are going to wear masks. And I think we're going to have an election that while it's going to be unique in that people have masks and other things, I think it's going to go off just as exactly as the multiple elections that we had around Mississippi over the last 6 months during this pandemic.
We've got Hunter Dawkins.
Thank you, ma'am. Thank you, Governor. Quick question, or 2 questions for you and Dr. Dobbs. Dr. Dobbs, the first question would be the AP released a story this weekend on an antibody drug that could become to most hospitals towards the end of the year, which could help pretty much stop coronavirus movement in its place. And my question would be, do you believe that the hospitals will, bring that into place during the end of the year time period as listed? And the second question I have for you, Governor, is Initiative 65 has been a pretty large divisive issue, speaking out with a lot of op-eds from both sides of the fence. Do you have a position, and what would it be? Thank you, sir.
Well, I'll start since you started with that one. We have gotten some notification that there may be, kind of like with the remdesivir, there may be an early distribution available of a antibody cocktail that we would be given to hospitals. I've seen no data on efficacy. I do believe it's like a 1-hour infusion, and so as far as like the patient population for which it would be indicated and the efficacy of it, I've not seen any data yet. So we are aware it's kind of out there, and we've only gotten the most preliminary of sort of notifications that we will have more conversations essentially.
Well, thank you for the question, Hunter. I appreciate that. I feel like I spend a lot of time saying this, but I'm going to say it again to the people of Mississippi. I have 3 daughters, one 15, one 13, and one 8. And because I have 3 daughters, I certainly understand the intent of those individuals who were successful in getting Initiative 65 on the ballot. But because of those 3 daughters and the concern that I have in putting marijuana in our state constitution and everything that goes along with that, I'm going to vote no on both, and I encourage my fellow Mississippians to do the same. I'm also going to vote yay on 65A on the second question because I think that's the smartest way in which to take that vote. So I'm going to vote no on both on question one. I'm going to vote yay on 65A on the second one.
There you go. Will Stribling with the Zeta Times Tribune.
Hi, my question is for Dr. Dobbs. What is your assessment of the current state of Mississippi's long-term care facilities? Have you noticed any trends among those that have had larger outbreaks or differences in response between them and those facilities that have experienced little or no spread?
Yeah, you know, that's a complicated question. There's so many different facilities, and each one's its own sort of unique story. I'll say that in general, you know, we're in a lot better position than we were coming in through the spring, and the spring was really difficult, and even then the majority of our deaths were within long-term care, nursing home settings, and then even though we had a lot of deaths in the summer, the majority were not in long-term care. We certainly able to get more protective equipment, testing is a lot more available. We have, you know, regular routine testing occurring in all the nursing homes now, and so that's helpful. So I think we have seen some outbreaks, and we've seen a little bit of an uptick in outbreaks recently, but I do think our preparedness we're much more prepared, and we continue to learn as we go forward. Now, will I say that there's some variability in quality of the infection control practices? Absolutely. And we've seen that in some places that are super diligent, that take it super seriously and are appropriate in the use of PPE, they'll do better. And there's the way to do it better, and there's a way to not do it quite as well. And so we'll continue to work closely with all the centers trying to optimize the infection control practices. But there's some variability in the fastidiousness to the infection control practice.
Yes, Governor, you mentioned earlier that you're not considering looking into requiring masks at all polling places, but in the counties that have these orders, will they require to wear if they are indoors voting?
No, there is an exception in the executive order for voting precincts. It is not required. But what I think you will see is the vast majority of people that go to vote in Mississippi next Tuesday, just as we've seen in multiple elections throughout the state. Most people will wear a mask. I plan to vote on Election Day. I plan to wear a mask to the polling place, and I would expect that the new place that I vote, that most people that are there working will have on a mask. Follow up?
Yeah, that's not necessarily a follow-up to that, but it's a different question.
Sure, go ahead.
Earlier you were referencing the World Health Organization, and the president in the past has been distancing himself from them, just defunded in some way. Would you say that you're in support of their initiative, or do you think or do you stand by the president in moving away from the World Health Organization?
What I would simply say is that throughout this pandemic, I have read a great deal of information from organizations around the country and around the globe. I don't necessarily take the advice of everyone in every organization around the globe. I get most of my advice from Mississippians like Dr. Dobbs and Dr. Byers and their team. But I also want to make sure I understand what others are saying. I think the World Health Organization has made some tremendous mistakes throughout this process. But I think it's probably fair to say that everyone that's been in the decision-making mode during COVID-19 has made a few mistakes. And so I'm certainly not signing off on exactly everything that they have said or done, but I did think it was important to point out that there are some leading experts that have advocated for exactly what we've tried to do for the last 6 months, and that is localized decision-making. Yes, sir.
Thank you, Governor. Going back to the 7 counties that are under a mask mandate, I guess it is a two-part question. Why is there an exception for the polling places if we're expecting a lot of long lines, people standing shoulder to shoulder indoors? Why would that be an exception for the mask mandate? And just in general, what does the average resident of this county need to know? So where do they have to wear a mask? Would they have to wear one going, taking their kids trick-or-treating or going to the stores, etc.?
So I'm going to answer the second one first and then the first one second, if that's okay. Go ahead. Where do you have to wear a mask if you're in one of these 16 counties? If you are indoors outside of your personal home, then you most likely have to wear a mask. if you are in these 16 counties. Why is there an exception to voting? If y'all will recall, and this seemed to bother everyone a lot less when it fits your political narrative, but if you'll recall, whenever the protest started to occur around the state, we had lots of different measures in place at the time, including gathering size limitations. And if you'll recall, the first protest I remember during 2020 was actually a group of folks who, by and large, supported me in the campaign last year, who were upset and didn't think we should have any restrictions in place. And then after that, we had as many as 4,000 or 5,000 people protesting in front of the governor's mansion. And if you'll recall, while I didn't encourage that, I certainly didn't try to break it up either, because I believe that to be a constitutionally protected opportunity for individuals to gather. When it comes to voting, I believe that everyone has a constitutional right to vote, assuming they have not stepped on that by committing felonies, etc. And so I believe that it is not prudent, nor is it legal or constitutional for us to restrict one's ability to vote, or to make it in such a way where wearing a mask is required. And so that's the difference, the way I look at it. But again, I strongly encourage it. I would encourage Mississippians, when they go to the polling place next Tuesday, to be prepared, to be aware of their surroundings. If someone is in front of you in line, just stand 6 feet behind them. You're not going to get to vote any quicker or any slower if the line is spread out over 100 yards rather than the line being spread out over 20 yards. You're going to vote just as quickly as you can, and that's a way for us to help slow the virus. But I believe that we can do it in a safe, responsible way. I think the vast majority of people are wearing masks, particularly when they're indoors right now throughout Mississippi, and I think that they absolutely should. Yes, sir.
Governor, I have a question kind of in that wheelhouse. We've seen in a few other states where people would wear campaign hats, shirts when they go to vote. They would be asked to remove it, and they didn't, and that became a problem. They claimed they had freedom of speech. As you know, state law here prohibits those activities within 150 feet of a polling place. What concerns do you have as we get closer that people might make a scene, as we've seen in some of these other states, because they want to do what they want regardless of state law when they go to vote?
Well, I certainly hope that people will not decide that Election Day is the day to make a scene. Obviously, there is a very polarized electorate right now. There's no question about that. We're going to have a very close election across the country, and there's no doubt that in some other states there have been decisions made that concern me, of course, with respect to mail-in voting and mailing ballots across the board. I'm very concerned about all of that. But at least what I want to say to my fellow Mississippians is I believe that we're going to turn out in record numbers next Tuesday. I think we're going to have a safe election. I think that President Trump is going to overwhelmingly carry the day in our state. And I don't think that that next Tuesday is the day to try to make a statement. The way to make a political statement on next Tuesday in Mississippi is to go to the polls, vote for President Trump and Vice President Pence. The way to make a political statement is, if you're in North Mississippi, go to the polls and help reelect Justice Josiah Coleman. If you're in other parts of the state, go to the polls and elect conservatives across the board. That's how you make a political statement, is by your vote. And so I'm very hopeful that my fellow Mississippians will heed the call to action, go vote, and let's make a political statement in Mississippi by delivering Mississippi for the president's reelection at a rate and at a level significantly higher than anything that we saw even 4 years ago. Yes, ma'am.
All right, Bobby Harrison.
Hi, Governor. I was going to ask, just to make sure that I thought that was right, that you were not mandating or trying to mandate mask wearing in the 16 counties at the precincts. So you covered that, but as long as you're As long as I have the question, I'll just ask you real quickly. You kind of touched on it, but how are you going to vote on the initiative to take the House out of the equation and elect statewide officials?
Yeah, well, thank you for that question. There's a number of ballot initiatives on the ballot. Obviously, I mentioned 65 earlier, which I'm going to vote no on both. On the first question, I'm going to vote yay on 65A. On the second question, the other initiative that is on the ballot is an initiative that was brought forth by the legislature because of a lawsuit that was filed during the 2019 election. That lawsuit was filed in such a way and for the sole purpose because they didn't believe that their Democrat nominee for governor could win a majority of House districts across Mississippi. So Mississippi right now has a bit of a electoral college in its current constitution. That electoral college requires that you win not only a majority of the popular vote in the state, but you also win a majority of House districts. Interestingly enough, the Democrats for well over 100 years didn't deem this as offensive to them when they controlled the House of Representatives, but since Republicans now control the House of Representatives, they have decided that this is an offensive. It is offensive to have the Electoral College. It should be pointed out that Democrats in Washington now also believe that the Electoral College in the United States elections process is offensive to them as well. And so, you know, it's unfortunate. It's kind of like the Democrats in Washington for the last 150 years have thought it was perfectly fine that if a Supreme Court justice unfortunately either resigned or unfortunately, as in the case of Ruth Bader Ginsburg, passed away during the term of office, they now decided that it's not fair for the sitting president and the sitting United States Senate to go through an advise and consent process. Fortunately for America, the president has performed his constitutional responsibility and appointed Judge Amy Coney Barrett, someone from the southeastern United States, from New Orleans, a conservative who served on the 7th Circuit in the north part of our state. And to the credit of the United States Senate, they have performed their constitutional responsibility. They gave Judge Barrett the opportunity to go through the confirmation process, and luckily and fortunately for the United States of America, the United States Senate is expected to vote later today to confirm this conservative female judge to the United States Supreme Court. So I'm very pleased that that is happening, and I will tell you, I think that's why, as I mentioned earlier, it's important for everyone in Mississippi, particularly those in those areas where there are Supreme Court races in our state, to go to the polls and vote for conservative judges like Justice Josiah Coleman to be reelected to the Mississippi Supreme Court, because the judicial branch of government matters. There's certainly an argument to be made that at the local level, at the state level, judges may or may not should be elected, and that's a different debate for a different day. But in our state, the current system is that we elect our Supreme Court justices, and if we're going to elect them in our state, I think we ought to elect those who interpret the law, not those who would try to write the law. And so I hope that all of my friends in North Mississippi will go to the polls and vote for Justice Coleman. Yes.
Bobby Harrison has a follow-up.
Governor, I'm sorry you didn't answer my question. How are you going to vote on that provision? And it's a provision that was put in the Constitution solely to keep African Americans from being elected to statewide office. Are you going to support keeping that in the Constitution or taking that out of the Constitution?
Well, I will tell you, I think if you look at the number of provisions that are in our Constitution, it was actually the Democrats who put in our Constitution, in our statutes, the provision which required the 50% majority because the Democrats didn't want African Americans to win Democrat primaries in our state. And so as I look at that particular amendment, I think it's highly likely that it's going to pass. I think that's perfectly fine. When I ran for election in 2019, I did so knowing what the Constitution required me to do to win. But I'll tell you, Bobby, I think in our state, we were able to get not only 52.5% of the vote last year, we were able to get a large majority of House districts that we won. I think if this provision passes, at this point, it's going to make it harder for Republicans to get elected. And so since we do control a supermajority of House seats, and so I think there's something that we need as a state to look at, and so I'll leave it at that.
Yes, sir. Yeah, question for Dr. Dobb, shifting back to COVID. Last week, there was a restriction added on hospitals to reserve 10% capacity for COVID patients. How are hospitals adapting to that? We started to look, especially because you mentioned earlier that hospitalizations overall are still high.
Yes, so right now they're managing it internally, and I've been in communications with Hospital Association and numerous other hospitals. Some have delayed some elective procedures when they've gotten too full to make sure they have additional space. Others have opened up additional capacity or put patients in post-anesthesia care units or other places where are not traditional sort of intensive care units. So it's kind of like multiple strategies to kind of make sure we can take care of folks. I mean, right now they're managing reasonably well. There's obviously always going to be some sort of spot shortages. We run short of ICU beds on a regular basis anyway if we have a bad flu season. So we'll continue to monitor it closely, but right now they're managing it quite nicely on their own.
And let me just add to that. It is imperative that our hospitals do right by the executive order. If an individual is unable to get treatment in Mississippi because they did not adhere to the executive order, which requires 10% capacity for COVID patients, then that's going to be on the hospitals. And I think that's important for me to say. Dr. Dobbs and his team are working with the hospitals, as well they should, to make sure that doesn't occur. But I want to just reiterate to everyone that this is a requirement in Mississippi. And I fully expect and fully anticipate that hospitals throughout the state will certainly do that.
Governor, this is for Dr. Dobbs. In looking at the coronavirus page on the State Department of Health website, under statewide combined testing, it says as of October 10th. Now, I know that you're updating these on a weekly basis now, but it's now been more than 2 weeks since we've had updated numbers as far as testing is concerned. Can you talk about why that is?
I'm sure it's just a sort of if we're a week behind, and so if we're not up there yet, it's going to look like it's 2 weeks behind. I'll see why it's not there. I mean, reporting of testing is, we are trying to get to where we can do a % positive. There's a lot of mechanisms through which we get that information, and one of the sort of routes that we send it through to the HHS and White House is there's an electronic reporting system called COVID Electronic Lab Reporting, and so we're the ones who submit the data so that we have it. So anyway, we're going to try to get something out there pretty soon where we can monitor it, but the lumpiness of it was just too disruptive when we were getting 50,000 in one day and then 10 the next day, and it really looked kind of really crazy the way that we get them in.
Can you kind of give us an idea of the positivity rate in recent weeks and how that's been trending, since it's kind of hard for us to determine it?
Yeah, and I don't know if you saw, but I tweeted something out last week that showed it, and we had gone up to about 9.5% something like that. So we have been trending up, and it's important when you look at stuff to look at multiple sources of information so that something is skewing one or the other. But we have seen a trend in increasing cases, increasing hospitalizations, and increasing percent positivity. So it's a real phenomenon. It's not an artifact of something else. Thanks.
Dr. Dobbs, and this is something we talked about in the summer a bunch of times, but could you just reiterate this again? What happens when hospitals do fill up? What impact does that create on the state?
Yeah, it's really challenging when hospitals get full, and it's not just for COVID; it's for everything. And one of the real problems is it's just not when a hospital gets full, but they all get full at the same time. Where do people go? Well, there's just nowhere to go. We have people who can't get transferred from rural areas to hospitals need to be taken care of. Traumas don't get taken care of. We have to ship people. We had to fly a stroke patient to Atlanta in the middle of the summer, which is crazy. We're flying helicopter people from the Delta to Laurel because, crazy stuff we were doing just trying to take care of folks. So it really upsets the normal healthcare infrastructure where we can take care of folks. And it's not just COVID patients. It actually is probably even more non-COVID patients because if you have a heart attack, you still need to be taken care of. There's not an independent healthcare system that's demarcated for COVID or other things.
Thank you. Dr. Dobbs, this one's also for you, and I do have a follow-up afterwards. Can you, I'm sorry if I'm making you repeat yourself, can you go through the numbers again when it comes to how many COVID patients are on ventilators right now, how many are in the ICU, and how much breathing room do we have right now? You had mentioned, I think, 6 hospitals don't have any room, if I heard you correctly. So how much breathing room do we have looking at these specific numbers? Yeah,
so, and all these numbers are on our website, and we try to keep it where you can look at even every hospital if you want to, for that information. But we have 580 patients who are currently hospitalized and confirmed COVID. These are yesterday's numbers. We have 157 in ICU and 66 on ventilators. 6 major medical centers have no ICU beds, but that's down from 9. We had a peak last week. There's 19% of ICU beds currently available, and among the major hospitals in Jackson Metro, 3 ICU beds are open.
3 ICU beds are open out of the entire hospitals in the Jackson Metro, you said? So I'm not trying to, I want to make sure I word this right. So, we obviously don't want to tell people to panic, but how much, what can we do to try to keep lowering it, and how much room does that say we have? How easily could it go down to 0?
Fortunately, when it's not overwhelmed for the whole state, there's some sort of ebb and flow, and there's also some expansion capacity that hospitals have. So we haven't been getting any complaints. Most of the hospitals are not on diversion. There's another thing that we monitor too. So, definitely don't panic, but don't get COVID, right? Just do the simple things we know. Small groups outdoors, wear a mask, those basic things. The main thing is just, stay healthy and get a flu shot. Now's your time. End of October is the end of the CDC's recommended time period, so please go and get a flu shot if you hadn't had one. I've gotten mine. Everybody needs to do it.
And my follow-up, by the way, I was just looking at your Twitter, and you did tweet about Halloween. So would you recommend that everybody, no matter what they're wearing as a costume, should they wear this mask under their mask and going out, etc.?
Yeah, unless you want to be a ninja, and then you can sort of combine them together, right? Wear a mask. But make sure your kids are, not overly, can't breathe through something, but find a face covering that works so that you can have whatever your costume is along with your mask.
But the typical Spider-Man, Power Ranger mask, whatever, that you find at the store, would that at all make a difference blocking COVID?
Some of them might qualify as a face covering. It'd be kind of hard to look at each different one, but in general, we'll just have you wear a normal sort of face mask.
I just would add to that by saying I have also gotten my flu shot, and so I want to encourage everybody across the state to get your flu shot. There are hospital capacity challenges that we have in Mississippi right now. Prior to 2020, I didn't spend every day looking at hospitalizations and ICU bed usage, but it is my suspicion that there are times throughout every year where we have hospital capacity issues in our state, so we need to be honest about that. I'll give you an example. We've got 679 patients in hospitals today in our state that are either confirmed COVID or suspected COVID. 679, which is a relatively large number. At our peak in late July, early August, that was at 1,250. And so if you look at total number of patients in ICU beds today, we have 157 with COVID. At our peak, that was at 337. So many, and I say all that simply to say, by the way, our total number of patients on ventilators right now is 66. One thing I would say is I think, and this is a credit to our great healthcare workers, we're getting better at treating COVID, I believe. We're putting patients on the ventilator less early, as I hear anecdotally from docs around the state, which probably is having better outcomes. There's a reason they call it the practice of medicine. When you have pandemics such as this, you've got to figure out the best way in which to do treatments, and our docs around the state are doing a great job doing that. I say all that to say we're still at about half in terms of total number of patients in the hospital with COVID, and less than half than at our peak. And so many of our capacity issues in our healthcare system right now are the fact that non-COVID patients in hospitals are up significantly over the last 3 months compared to where they were, and that's the reason we had to reinstitute the executive order requiring that 10% of capacity is maintained. Because I will tell you, and I don't know what the number is today, but I looked within the last 10 days, the University of Mississippi Medical Center, for instance, which is clearly one of the most important pieces of our overall healthcare system in our state, because they are the lone level 1 trauma facility. One day, a week to 10 days ago, I looked, they have 80 ICU beds at UMMC. They had 8 patients with COVID in an ICU bed. I don't think anyone would expect that 8 patients of COVID at UMMC would cause them to have 0 ICU beds available. So a lot of this capacity issues are non-COVID related. It doesn't matter the reason for it if you're in a car wreck and you don't have anywhere to go. And so we're trying to manage our way through it. But I think all of those are pertinent conversations. So, yes, sir.
Governor, and this is for you and Dr. Dobbs. As far as the elephant in the room, and again, I'm going by total cases. I know you guys have other metrics, and so I'm not trying to, being transparent in the process. But here we see again DeSoto County with the most new cases over the last 2 weeks. What is going on up there? It certainly seems to have more than any other county in the state, and it has only gotten, it only seems to have ramped up in recent weeks. If you look at daily average cases just for DeSoto, it seems to be getting ready for a second wave there. Can both of you talk to the reasons behind that and what you're seeing and how to be effective there?
I'll just give you the numbers just so people can hear. Again, I want to give the facts, and I'm going to let Dr. Dobbs may have some information that he has determined from his contact tracing. DeSoto County, 760 new cases from October 5th through October 18th, and even though it's one of our more populated counties, 410 per 100,000 residents. And so I don't recall at any time during this pandemic one of our larger counties having a higher number of cases per 100,000 residents. I've seen other counties that are very small population centers have more than that, obviously, but the combination of the total number of cases and the cases per 100,000, DeSoto County is at a point now in which it is probably for large counties in as bad a position, just looking at the quantitative numbers, as any large county in the state has been throughout this entire pandemic. So,
broad-based community transmission. People are just spreading it, and not the safety measures are not widely adopted, and that's just what's going to happen. There's not any specific thing. It's just really prevalent in the community, and there has been a little bit more reluctance in DeSoto County to embrace the things we know that work. And if we do the simple things, it works, and if we refuse the simple things, we get COVID spread. So it's a very simple equation.
The other point I'll mention, and it is widespread transmission, as Dr. Dobbs has pointed out. One of the things that you see, if you look at the sort of heat chart of America, which we've watched and is in most of the White House reports on a weekly basis. You look at it 3 months ago, 2 months ago, 1 month ago, and now what you see is it is much darker red moving up towards the Midwest and the North Midwest of our country. If you look at Mississippi and our total rates, as I mentioned earlier, our R-Naught's below 1, which we're the only state in the nation that has that. That can change quickly, so I'm just pointing out the fact. But if you look at Tennessee and Arkansas, they did not necessarily fare the same as we did back during the summer, but their number of cases in Tennessee and Arkansas and Oklahoma and up sort of in the Midwest of Mississippi, those numbers have been going up, and it seems like DeSoto is trending more like what's happening in DeSoto and Arkansas, and it may be the metropolitan area and the greater Memphis metropolitan area is a reason for that. But there's no doubt, just looking at the quantitative data, the county itself of DeSoto is probably in as bad a position today as any large county in Mississippi has been throughout the pandemic.
Thank you, Governor. I was wondering if you could touch up on something you brought up after visiting the White House. You had mentioned that rapid testing was coming out of the Trump administration, finding results in maybe 15 to 20 minutes, if I remember. Where are we with getting those test kits to Mississippi, and what would you use them for?
So we have received some of those test kits. The Department of Health is using them, and I'll let Dr. Dobbs tell you exactly which facilities that they have sent them to. I know that part of our goal and part of our strategy is to make testing available in every county, particularly for education professionals, for healthcare workers, and others. Some of those have been distributed out to sort of backfill at our long-term care facilities. You know, we had 205 to 210 long-term care facilities that had an outbreak a couple of months ago during the summer. Now we're down to about 130. I don't have the exact number in front of me, but approximately 130. And so part of the reason we've been able to get that under control is because we are doing rapid testing at our long-term care facilities for those workers on a regular basis. But I'll let Dr. Dobbs speak to the distribution of that if it's okay.
Yeah, so it's the Binax Now, the rapid card test. It's a convenient and quick test. It's really better used for people who are symptomatic. We know that if for asymptomatic individuals, it's not quite as accurate. It does miss a lot of folks, and so and this is not a surprise. I mean, we know that. So we're trying to target on people who are symptomatic or high risk, and so we distribute it to all the county health department locations. So please, if you want to get tested, go to any of our county health department testing locations. It's free, and now it's fast. Actually, I did it on Friday just to do a sort of like a undercover boss sort of thing, and 17 minutes I was in and out, no joke. Had a result. So please take advantage of that if you need to be tested. But the county health department testing locations, state veterans homes for testing, helping with long-term care settings. Corrections is going to be a target, and also too, one of our targets is going to be for the community health center. School-based clinics are going to be our sort of first wave of distribution. We do have sort of like a distribution plan agreement that we've sent out for locations that are within those priority zones to get access to it.
So you're saying all 82 Mississippi counties have these now. Do you know how much the state got and what?
We had 58,000 the first week we got them, and I think we had another 44,000 allocation, and I don't know that we've gotten any more since then. I think that's it.
Total is $150 million. The federal government bought $150 million. They paid $5 per test, so it was a $750 million expenditure, and Mississippi's allocation is approximately 1 million tests. Obviously, they are producing them as we speak and sending them out. And so Dr. Dobbs says we've gotten about 100,000, so that we've probably gotten 10 to 15% of what we're going to get. So, well, it's now 3:30, so we've had a very good meeting. I don't see any other questions at this time. I just want to conclude by, regardless of what county you live in, if you live in 16 counties, there is a mask mandate for indoor areas. There's also a limitation on gatherings for social purposes in those counties. But just because it's not in the executive order, and just because it's not the law doesn't mean it's not a good idea for all of you to wear a mask when in public, particularly when indoors. So I want to encourage everyone to wear masks, to stay socially distanced, to limit crowds, and to be safe. God bless Mississippi.